Hello friends. Now I am going to talk about an entity about which way you and every one of us has been hearing right since our childhood, an appendicitis, an appendectomy, an operation for that. We all hear this thing right since our childhood. It is one of the most commonly affecting disease in general population, whether it is male or female. The incidence is right from the first decade of the age and it goes on till almost around 50-55 years. Thankfully, the incidence of appendectomy after late 50s is not much, and therefore the population below 50 is definitely vulnerable for it. Why do we see it? Why we see a lot of patients with appendicitis nowadays? I think one of the reason is our bad to worse lifestyle. Less water intake, constipating foods like all junk and fast foods, absence or minimal presence of green leafy vegetables, vegetables in general, a sedentary lifestyle, and so on and so forth are all the factors which induce constipation and situations even like appendicitis. We see a lot of children who have gained a lot of weight thanks to the food habits, and this also is one section of the society in which we see a lot of appendicitis. How does a patient feel? How does a patient present with appendicitis? Well, the cardinal most important thing is pain and severe pain, usually starting from the middle of your tummy and then probably in some time over a period of 12 to 24 hours localizing to the right lower side of the abdomen, wherein it will remain constant. The pain can be quite unnerving, needing immediate medication, injections, sometimes even hospital admission. And this will be associated with lot of dyspepsia, nausea, in some patients even severe vomiting. This is one of the most classical ways in which appendix presents, and it is also called as acute appendicitis. Well, we have a small section of patients where all these dramatic symptoms may not be there, and the patients may complain mainly of dyspepsia, fullness of tummy, bloating, especially after eating food, few hours after consuming food. The pain will be dragging, sometimes dull, sometimes severe, but will keep localizing to the right lower quadrant or the right lower side of the abdomen. Appendicitis is a clinical diagnosis which a doctor makes after examining the patient. We see a lot of patients coming to us with CT scans, ultrasound abdomen, MRI and things like that. Trust me, even in 21st century, the best diagnosis of appendicitis is made by a clinician, a doctor who examines the patient. And thereby, a lot of appendicitis patients, they don't need CT scans and things like that unless and until a complication has happened or we are dealing with something else or there is a diagnostic dilemma. So what does a patient need to have? Well, he needs to have some basic blood tests like complete blood picture. We also need to show and be sure that there is no urinary tract infection, especially in young women, and thereby we also ask for a urine examination. In young, fertile or what we call as menstruating age group women, we need to be very sure about the gynec history and things like that before we come to a diagnosis. An ultrasound helps in appendicitis as a way what we call by diagnosis by exclusion, wherein we exclude that there is no right kidney stone, there is no right ureteric stone, and in women the right ovary and fallopian tubes are clean. But mainly, and I would re-emphasize this, that appendicitis still remains a clinical diagnosis. All the investigations which we do, they aid the diagnosis. They don't make the diagnosis really. The second important factor is appendicitis can be dramatic and can present with complications like number one, perforation, wherein a patient who is having abdominal pain will suddenly become sick, his pulse rate will go, he'll start having high grade fever and so on and so forth. The pain will not be relieved by any analgesics conventionally. You should always suspect a perforation of appendix. Likewise, the patient can also present to us with what we call as an appendicular abscess, wherein it has perforated and there is a nice pus collection around the appendix. So a small disease ignored at that particular time can present to us in a very dramatic way and with lot of complications. Well, the treatment of appendicitis in one sentence is an appendicectomy, an operation. All the medicines which are used to treat appendicitis or associated conditions will give a temporary relief, will elevate the pain for some time, will reduce the infection, but will not take away the problem. I strongly recommend that a simple operation is the best remedy. This surgery also can be done by a conventional method, an open surgery, or a laparoscopic method. And appendicitis is a situation which can grow from simple to bad and worse within no time. Thereby, don't waste time. Try and seek an early treatment. Number two, don't get feared by the fact that you will need an operation, because in the final run, a simply done, timely, nice operation will save you from all the possible complications and trauma you go through. Thereby, I request you to make use of me through this wonderful medium, or you are free to consult me at my consultation rooms at your wish and will. Thank you.